Hello everybody, this is Dr. Mike here from Functionised. Today we're going to talk about pain. But first, if you haven't been keeping up with this, first off, shame on you. But all of us here at Functionised, we're going to start doing these little mini podcasts throughout the week. So if you haven't noticed, there's probably plenty of shows for you to start catching up on. Because not both, but myself, the mad scientist himself, Jim Getz, Shantae Getz, and Christine, we're all going to start throwing out these little mini podcasts throughout the week. So that way you can always get these little extra tips to help make yourself more functionized as we go. But we'll still have our standard interviews and longer shows that will be posted out on Fridays. So let's go ahead and let's start delving into here, because a big thing that we do here at Functionized is just try to promote everyone to be their best, whether it's trying to be your best performing athletically, trying to do your best on academics, whether it's your best in relationships or any other aspect of your life. Our goal is to try to help get you to there, realize your full potential. And there's always these little small snags that tend to get in people's way. But unfortunately, one of the big ones that affects a lot of people is being in a crap ton of pain, especially when it's been almost all the time, every day for years. There is a term that gets thrown out there a lot to describe this, and that is fibromyalgia. So about 5% of the U.S. population is diagnosed with fibromyalgia. That's 1 out of 20 people are pretty much in constant full body pain. Clearly, this is an issue. There are several things outside of fibromyalgia that can cause full body pain. It can be anything from, a big one's dehydration. So, if you think about it, when, let's say, you're cooking steak and you overcook the steak, it becomes very dry, it gets relatively rough, less pliable than it was while it was moist. And that's exactly what happens, well, not exactly, but very similar to what happens to, our own muscle. Other major things that can cause full body pain is chronic stress, which we'll touch on a little bit more. Big one is side effects of medication, especially when there's multiple medications involved. You can end up having joint pain, full body pain, and most of the other symptoms we'll talk about that is correlated highly with fibromyalgia. There's another big one that is probably the case more often than not, and this is systemic inflammation, most commonly from sugar, but it can be from any real food sensitivities or allergies that one has. And a great way of doing that is, or figuring out what exactly food is causing that outside of sugars, by doing ALCAT testing. So there's also various nutrient deficiencies as well as arthritic conditions like rheumatoid that can cause this full body pain. One thing that's not necessarily associated with those things but is with fibromyalgia is this other laundry list that is correlated, and there's a reason why. So people who do have true fibromyalgia tend to have a couple other issues. Some of the most common ones is insomnia, headaches, major stomach aches, or just gastrointestinal discomfort, chronic fatigue or adrenal fatigue as many people call it, muscle spasms, depression, and about 70 to 80% of the time there's also usually some sort of emotional or mental abuse or trauma of the PTSD sort of variety in people with severe or fibromyalgia. So, as always, what it comes down to is when you're trying to solve any sort of issue, whether it's a puzzle, a game, or especially in this case, a medical issue, is make sure you have the right diagnosis. What is causing this to occur? So, unfortunately, fibromyalgia has kind of been thrown into one of those diagnoses of exclusion, meaning if we've done all the tests, we've tried everything, it doesn't appear to be anything else, you must have fibromyalgia. This isn't the best way to diagnose anything, but it's there for a reason and is better than the previous ways of diagnosing. The way most medical professionals used to do it is that there was this full body pain scale method where you would stand there and the examiner would start poking these specific spots. And if you said ouch to enough of them, you had fibromyalgia. These spots weren't really the best way of doing it because these were mostly where muscles attach or where you commonly get trigger points and knots to begin with. So even if you are healthy, you don't have full body pain. If I came up and started poking you in these spots, most of the time you're going to feel it whether you're fully healthy or not. So there is a reason why all these other comorbidities, especially the chronic fatigue, depression, bowel and bladder issues, and stomach aches, tend to be there with most fibromyalgia patients. The main reason actually ends up being much more neurological and gut related than it is musculoskeletal. What it comes down to, it appears with all the research, is that there is this neurotransmitter called serotonin. Serotonin is one of those feel-good chemicals, one of those endorphins that gets released when we're doing something pleasurable. So typically exercising, eating some favorite food, having sex, or just kind of relaxing or doing things that you generally enjoy is going to release serotonin to help kind of reward you for doing happy, healthy things. So a lot of times, people with fibromyalgia have much lower levels of serotonin than not just the general population, but lower levels in their body than people with other chronic pain disorders, such as rheumatoid arthritis. So there is a connection here, and it explains a lot of the symptoms very well, which we're going to get into pretty much about right now, especially when it comes to why do we feel pain if we have low serotonin. Is one of the big things that serotonin does is help block other chemicals that makes us feel pain. So for those that haven't taken a physiological or a physiology class in the last couple of days, there was a chemical called substance P. Substance P is really what allows us to feel pain, which, believe it or not, that is a good thing. We do want to feel pain. There's actually a rare condition out there that makes it so that we don't feel any pain. And these people that are born with it generally don't survive too long because it's hard for us to try to adapt or change our habits if we don't realize it's causing us issues. I mean, if I broke my foot or have a knife in my back and I don't feel it or know it, I'm not going to last too much longer. But anyway, so substance P is going to let us feel pain. One of the big things serotonin does is inhibit or stop substance P from taking effect. So that way we don't feel pain when we're not supposed to. So when we're low serotonin, we're going to feel pain more often, and it tends to hit us mostly in the joints. So that's where a lot of our neurotransmitters end up being released. So for those that have heard of like serotonin or dopamine, you know that these neurotransmitters are basically hormones, so to speak, or in a lot of reality they are, of our nervous system. But what a lot of people don't seem to know yet, or they forget about, is that our nervous system is a little bit more than just our brain and our spine. Though those are two huge components of it, there's also a large part in our stomach called our enteric nervous system, our second brain, so to speak. And the reason why this becomes a big issue is that a lot of people with fibromyalgia have these major gut symptoms. And there's a reason for this. The majority of our serotonin, 95% of it, is actually made in our gut, not in our brain. So if we're having gut issues or there's poor gut health, we're not making serotonin. So when we keep talking about how gut health is the basis of all health, mentally, emotional, physical, it really is. And just to go on a quick side touch, when I've talked about, the second brain being in the gut, that's not part of our nervous system that does conscious thought, thinking, higher levels of processing, but it mainly so that when we're sleeping or we're doing other things like thought-provoking activities or even just listening to a podcast, our brain doesn't have to deal with all the digestion, doesn't have to deal with our heart beating, doesn't have to deal with all of our gut moving and processing, making enzymes for serotonin. It allows our gut to do that for us. So let's say you have full body pain, you have these gastric symptoms and maybe some of the other stuff attached to it like insomnia or headaches. What can you do, or what would your medical professional do for you? So there are some common methods. Let's say if you go the more medical route, one of the first things people are going to do is give you what are called SSRIs, or selective serotonin reuptake inhibitors, which is just an acronym with long words behind it saying that when our body releases serotonin, these drugs are going to help keep the serotonin in our system longer, so they can be kind of, in a way, double dipped and used a little bit longer in case we're not making enough of it. There's also a reason why those end up causing a lot of headaches or gastric issues and a lot of fibromyalgia type symptoms, because again, it's not really helping the issue of the serotonin on its base. So other common methods that people do is supplementation, or there's also neurological retraining and biofeedback, which here at Functionized we can help with. So even if you do your own little research, it is never recommended to try to self-treat, even through natural means, medical conditions without some sort of guidance of a competent medical professional. However, there are a few things that we can all do to help with our serotonin levels, as well as many other aspects of our health. One of the big ones is moderate exercise, at least 4 or 5 days a week. So again, by moderate exercise, I'm not saying, walking for 30 or 40 minutes. Frankly, that's just not enough. As humans, we're meant to move. We had to move to survive back in the day, more of our aboriginals, because if we didn't, well, we usually mauled by a bear, or we didn't get the food that we needed, or we didn't get the shelter up in time. So our body does very much so reward us for staying moving. So exercise as, relatively well 4 or 5 times a week. Another big thing you can do is get exposure to more sunlight. So go exercise outside. The reason for this is that there is a connection of being able to make serotonin from melatonin, which is another little hormone-like chemical that's made when you are exposed to light for long periods of time, or certain variants of light. Stress reduction type activities such as meditation, or in this case walking, can sometimes help to help relax your mind and body. Or if you come join a functionized yoga class, things of that nature usually do pretty well. And then again, back to restoring the gut health. Why aren't you making serotonin? Why are we having all these issues? A lot of times it does come down to what we're eating. So figure out what kind of food sensitivities we're having. Are you eating too much sugar? What's going on? And there are ALCAT testing that we can do to try to help anyone with that, so you're putting the right things that are meant for you in your body. So hopefully this isn't pertinent to you or anyone that you know, but if it is, always, send us a direct message or schedule an appointment with us here at Functionized, and we'll do an exam to see if it is something, if it's true fibromyalgia, or maybe you just need to start drinking more water, change your diet a little bit. We'll do what we can to try to make you get a more productive, pain-free life so you can just perform better with all aspects that you want. So on that quick note before we kind of delve off for the night is that, as always, if you enjoyed this information, you want to hear more, you want to help try to get the word out, please, these honest 5-star reviews do go a long way. And again, you can always direct message us at Functionized, either on Instagram or Facebook, where there's just a comment to ask any more questions, or you just want to state some things that you're curious about on any topic, and we'll go ahead and we'll take a look at it for you to try to help give you more information, because if you're curious about it, odds are other people are as well. So at this point, Dr. Mike is about ready to go out. So until next time, everyone, hope you have a nice, fit, functionized week. Enjoy.